Hey guys, what's up? So, you all have been done with your Aims exam. So, what you need to consider now is that take my two genuine advices. Number one advice is do not waste more of your time thinking over your mistakes. Whatever mistakes has happened in your Aims exam is okay. But you need to do is that you need to focus over your NeetPg examination. Your next target should be your NeetPg examination. So, stop wasting your time to the mistakes you have already done in your Aims. The second genuine advice is that I would want you all to know all the answers to the questions asked by Aims people, because they will let you know the important topics, as well as if the NeetPg people repeat this, then you will be able to answer them in your NeetPg examinations also. So starting with question number 1, a pediatrician was called for attending a newborn baby. The serum unconjugated bilirubin was 33. Following drug was taken by mother during her late third trimester pregnancy. So what drug can cause this problem? The baby has a serum unconjugated bilirubin of 33 mg per dl. This means something is very wrong with the liver of that patient, of that baby. And as they have mentioned that the drug is causing a definite teratogenic effect, because even on taking it on third trimester, the mother is having this problem of teratogenicity in liver. So what can be this drug? Now you all know that FDA has given us some categories of teratogenic drugs which should not be used in pregnancy. So if you see, we have 4 categories: category A, B, C, D and X. 5 categories overall. So if you see, this cotrimoxazole falls in category D. So this D is something which you say that there is a positive evidence of human fetal risk. The azithromycin is category B. Ampicillin is category B. Chloroquine is also category, or you can say chloroquine does not have any known teratogenic effects. So answer here becomes cotrimoxazole belonging to category D. So what you need to do is you need to revise the drugs coming in these categories: A, B, C, D and X. Now moving to next question, which of the following drug must be sold by retail only on production of prescription by a registered medical practitioner? Now this is another important thing that you should know and is given by us, the different schedules. So if you see, the schedule H is something which contains the prescription drug. That is, those drugs cannot be given to you by any medical store without prescription of a registered medical practitioner. Now knowing this, you should also know what is schedule C, F, G, H, J, X, Y and W. Okay, so all these schedules are equally important for you. So if you see, the schedule C contains vaccine like insulin, sera, antibodies and all the biological and other special products. Schedule F contains standard ophthalmic preparation. G contains drugs with a label of caution to use except under medical supervision. H already asked. H is very important for your NeetPg, HIV and atherosclerosis drug. X is equally important, drugs having dependence liability. The supply of these drugs has been maintained and recorded in register. That is, the medical store persons or whoever is supplying this drug has to maintain a register for their supplying. Y is clinical trials in India and W is drug marketed under generic names. Okay, so these schedules are very important. Make a note of them. Now moving to next question, low apparent volume of distribution of drug indicates that. Now if you see this Aims exam, they are very fond of asking the general pharmacology portion. So what you need to do is just revise your general pharmacology, because it is equally important for your NeetPg. So low apparent volume of distribution of drug indicates that. So if you see the option drugs, that it has a low half volume, it has low bioavailability, low efficacy and not extensively distributed. So if you see, the answer here will be the drug is not extensively distributed in the body, distributed to the tissue. So low apparent volume distribution it means that it is not extensively distributed in the body tissues. Use of lithium during pregnancy increases the risk of development of which of the following malformations to the body? So you already know that lithium causes Epstein anomaly, a rare form of cardiac anomaly, and thus the answer here will be cardiac defects. Which of the following is the most appropriate treatment of patients of tuberculosis in which mycobacterium is resistant to both isoniazid and rifampicin? Now this is an easy one. You should also revise the revised RNTCP guidelines and should know all the definitions. So answer here will be 6 drugs for 6 months and 4 drugs for 8 months. Okay, so you should know all the different resistant TBs, XTB and all the resistant types, because they are equally important. Now the other question they have asked is, which of the following drug has gametocidal as well as, means which of the following drug kills all the species of Plasmodium? So options were primaquine, chloroquine, quinine and none of this. So the answer is primaquine. Primaquine is one such drug which kills all the species of Plasmodium, which is gametocidal to all the species of Plasmodium. Dapsone is used for treatment of bacterial and fungal infection as well as for immunomodulatory action. So basically they want to ask the mechanism of action of Dapsone, and you all know it is a competition with PABA in folic acid synthesis. So it competes with PABA in folic acid synthesis and thus inhibits the fungal and the bacterial division. Now, acetazolamide is given to a patient of angle closure glaucoma. It is a non-competitive inhibitor of carbonic anhydrase enzyme. Which of the following so which of the following will be the effect of drug? Now they have already mentioned it that this acetazolamide is doing non-competitive inhibitor. It means it will be decreasing the Vmax. Now non-competitive, that's why the Vmax will decrease. So again, question from your general pharmacology. All of the following drugs require dose reduction in renal failure except. So here all are renal toxic drugs except doxycycline. So answer here will be doxycycline. Major determinant of loading dose of drug. Now you see again they are asking from general pharmacology. So understand how important it is. So here the major determinants of loading dose of drug, if you see the formula, both volume of distribution and bioavailability comes in its formula. But the major, they are asking major, that's why the answer here will be volume of distribution. Okay, so loading dose, you can see the formula here. It consists of amount of drug in the body divided by bioavailability into the salt fraction. Okay, so further, I'll be discussing further questions. I'll not prolong this video anymore. Second part of this video, so do watch it and get the correct answers which are equally important for your NeetPg.